I've been ordering the Oncotype DX test for nearly a decade, and I've been asked to share with you an instance where the Oncotype test has been most helpful to an individual patient. But quite frankly, the Oncotype test is helpful for all of my patients, whether they are the most common breast cancer, which is estrogen receptor positive and lymph node negative, whether they are estrogen receptor positive, lymph node positive, up to 3 positive lymph nodes, or more recently, ductal carcinoma in situ. Simply being able to avoid chemotherapy that isn't going to be helpful to patients is a major win. It's a major victory. And this is certainly the case with invasive breast cancers, where we end up with low recurrence scores. Similarly now with ductal carcinoma in situ, where we can avoid radiation therapy because of a low recurrence score, that's a major win as well. But let me share with you a dramatic instance that comes to mind. This is a 44-year-old patient. She's a single mom with 3 children at home. Children range in age from 8 to 16. She's working full-time and was operated upon me for a intermediate grade invasive ductal carcinoma, measuring a little under 2 centimeters in size. She had a successful lumpectomy, and she had 1 out of 3 positive sentinel lymph nodes. Now, historically, in a premenopausal patient like this, especially lymph node positive, they would often receive adjuvant chemotherapy. And the wear and tear of chemotherapy for this lady would have been quite significant. But fortunately, her recurrence score came back low risk with a recurrence score of 10. We were able to successfully avoid chemotherapy that frankly wasn't even going to benefit her, and the positive win-win for society, healthcare costs in this patient in particular was dramatic. In my practice, and I believe the practice of the majority of my colleagues, the value of the Oncotype DX test is significant. I will keep on ordering this test because it is truly valuable. Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.